You know the drill.
Madam Chair, Ranking Member Cole, and members of the subcommittee, thank you for the opportunity to discuss the President's fiscal year 2023 budget for the Department of Health and Human Services. Pleased to be with you today. Speaking of today, 255 million Americans have received at least one dose of the COVID-19 vaccine. 2/3 of adults over age 65 have gotten their booster shots. We've also closed the gap in vaccine rates we usually see fall behind for communities in some of our distressed areas. It pays dividends to surge resources, including tests and treatments, to our hardest hit and highest risk communities. We think the numbers show that. What are those numbers? 325 million free COVID-19 tests have been shipped out to Americans. 270 million free N95 masks have been made available to Americans. You all made it possible to have $186 billion available through the Provider Relief Fund. So far, we've seen some 766,000 claims submitted by doctors, hospitals, community health centers, pharmacies, labs, nursing homes, long-term care facilities, all of them receiving some very critical support at a very necessary time. More than 450,000 providers to date have submitted requests for reimbursement. Real money, real relief, real results. Beyond COVID-19, today more Americans are insured for their health care than ever before. That includes a record-breaking 14.5 million Americans who secure their health insurance coverage through the Affordable Care Act. In addition, thanks to you, we're now enforcing the new law that protects Americans from being blindsided by surprise medical bills. We launched Operation Allies Welcome, an HHS-led effort that has helped over 68,000 Afghan refugees resettle in America. We're coordinating nearly $300 million in nationwide support for the launch of the 988 National Suicide Prevention Lifeline in July. HHS has also made key investments to improve equity in areas like maternal health, where we've extended Medicaid coverage for postpartum care for a new mother and her baby from 2 months to 12 months. The President's 2023 budget lets us build on that record of investment in America's health. It proposes $127 billion in total discretionary budget authority and $1.7 trillion in mandatory funding, including newly proposed mandatory funding to provide for the Indian Health Services. It also asks for $82 billion for the President's pandemic preparedness proposal to get ready for whatever might come next after COVID-19. Considering that COVID has cost this country more than $4.5 trillion in direct support from the federal government so far, this is a no-brainer to prepare for the next pandemic. The funding we're requesting will be end-to-end for research, development, approvals, deployment, and effective response. Madam Chair, budgets represent not just dollars and investments, but our values and our priorities. This budget turns hardship into hope and inclusion into opportunity. And it's a commitment to finish the fight against COVID-19 and to build a healthier America. On that note, I want to acknowledge our collective national failure to fund the Indian Health Services at the level needed to meet our constitutional treaty and our trust obligations to tribal nations in America. But even more so, to point out how we failed to meet the elemental level of needed support to provide fair and sufficient resources to our families in Indian country. I've seen these shortfalls firsthand in my visits to Indian country, where more than 2.7 million patients are served by Indian Health Services. The President's FY 2023 budget takes a historic first step toward finally delivering on our long overdue commitments to tribal nations. In my written testimony, I detail our proposal to convert the IHS budget to mandatory funding, as Congressman Cole mentioned. And we do this not only because it's necessary, because we have to do it long term. We're so far behind. It bolsters significantly the budgets for IHS over the next 10 years. This budget is a strong start, but we must continue to shine a light and hold ourselves accountable on our promises. Madam Chair, I look forward to working with you and all the members of this subcommittee to make the President's 2023 budget a reality and to continue our efforts to improve the health and well-being of the American people. Working together, I'm confident we can give Americans real relief, real results, and real peace of mind. And with that, I'd be happy to answer any questions you may have.